Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. We're here once again to provide community members with the most up-to-date information on the local response to COVID-19. I'd like to announce that this meeting is being translated in American Sign Language by Mala Poe. A Spanish language translation of this press conference is being produced by Just Communities Language Access Network and will be available on the county's website and YouTube page shortly. Although this public health crisis is something new to us, many of our public health professionals have spent their entire careers preparing for an event like this. I'm grateful for the leadership and service of our medical community and emergency management team during this time. As our medical professionals do their part to respond to this pandemic, we must all continue to do our part. Remember to stay home, except for when you're running essential errands or briefly getting some fresh air. If you're feeling sick, treat your symptoms at home and isolate yourselves from others. If your symptoms are worsening, call your medical provider or the public health clinics. When you must leave your home to purchase food or complete other essential errands, make sure that you practice social distancing by staying at least 6 feet away from other people. Be sure to continuously wash your hands throughout the day and regularly disinfect high-touch surfaces. All of these steps are necessary to flatten the curve and preserve the capacity of our local healthcare system. In addition to the serious medical concerns associated with COVID-19, many local small businesses and workers are very concerned about the impacts that this pandemic will have on jobs and our economy. I want to let local businesses and workers know that the County of Santa Barbara is here to assist you. The Santa Barbara County Workforce Development Board has put together a COVID-19 business resource guide available in both English and Spanish. This guide includes information on loans from the Small Business Administration, Economic Development Collaborative, and Women's Economic Ventures. In addition to information on various other economic assistance programs, the guide also includes information on immediate steps that businesses should take now, such as contacting insurance providers, tracking losses, and keeping employees healthy. Our county is actively communicating with state and federal agencies as additional economic relief and stimulus programs are being created and deployed. In navigating the various assistance programs that are available to businesses, the Santa Barbara County Workforce Development Board can be consulted for free by emailing covidbiz, B-I-Z, at countyofsb.org. That's covidbiz at countyofsb.org. While we must all pay attention to the physical symptoms that are associated with COVID-19, it's also important for us to recognize the emotional impact that COVID-19 is having on community members. The Community Wellness Team is here to help with a variety of emotional support programs and behavioral wellness services. The Community Wellness Team is made up of a variety of agencies and organizations, including the Santa Barbara County Department of Behavioral Wellness, Institute for Collective Trauma and Growth, the Mental Wellness Center, and Hospice of Santa Barbara, in addition to several other dedicated service providers. To learn more about emotional support services that can be accessed during this challenging time, please call the Community Wellness Team at 805-364-2750. There are operators waiting for your calls. Concerns about housing insecurity have intensified as a result of COVID-19. Understanding these concerns, my colleagues and I approved a moratorium on evictions at today's Board of Supervisors meeting in the unincorporated area that arise from the loss of income or medical expenses that result from COVID-19. This urgency ordinance also echoes the governor's request for financial institutions to halt foreclosures during this public health emergency. At this time, an emergency shelter for people experiencing homelessness has been set up in Santa Maria, and emergency housing will open in Isla Vista in the coming days. Additional sites are also being identified throughout the county. The resiliency of our community has been demonstrated time and time again. I know that although it will not be easy, we will get through this challenge time together. I'd like to close by highlighting the work of a local organization that's responding to the impacts of COVID-19 on our community. As mentioned before, local businesses are concerned about how they'll stay afloat during this public health emergency. Women's Economic Ventures, an organization that has offered microloans and self-employment training for local entrepreneurs since 1991, has created a COVID-19 quick response loan program. This program provides businesses with low-interest loans of up to $10,000 with a 3-year prepayment period. I'm very grateful for the work of Women's Economic Ventures to extend a hand to our small businesses during this very challenging time. Today, I'm joined by Dr. Henning Ansorg, the Health Officer for Santa Barbara County, Paige Batson with the Department of Public Health, and Sheriff Bill Brown. I'll now turn to Dr. Ansorg for his part of the update.
Thank you, Supervisor. Good afternoon. I'd like to again begin by thanking each and every person in our community who is taking action to stop the spread of COVID-19. Those of you who are staying home and actively practicing social distancing when outside are really making a difference. Today, we have updated information for you regarding our current cases along with their health status. We are working closely with our epidemiology team to ensure we can provide the most accurate and detailed information possible. We will have more information to share about cases and the regions where they are occurring in the coming days. With that said, please assume the virus is in your community. Assume you are at risk for contracting it, and take actions to stop the spread. If you have even mild symptoms, such as sore throat, congestion, diarrhea, cough, fever, or chills, please stay home until your symptoms have resolved and until you do not have a fever anymore. If your symptoms worsen or you have shortness of breath or painful breathing, please call ahead to your provider and seek medical care. Again, if symptoms remain just mild, follow home care instructions. We urge you to stay at home as much as possible to ensure we are doing everything we can to flatten this curve. We do anticipate seeing a significant rise in cases for days and weeks to come, but do not let this rise dissuade you from practicing social distancing. Our actions today will dictate how slowly or how quickly this virus will travel in our community. Thank you.
Next up is Paige Batson, the Deputy Director for the Community Health Division's Public Health Department.
Thank you, Supervisor. Well, today in Santa Barbara County, we have 24 cases of confirmed COVID-19 cases. We're happy to say that 4 of them have fully recovered completely. That means that they have completed their 14 days of monitoring by the Public Health Department. We do have 1 case that is currently hospitalized, and 19 are recovering at home with public health supervision. To date, we're also pleased to say that the Public Health Department has been able to effectively respond to and investigate reported cases of confirmed COVID. However, as the transmission of COVID becomes more widespread, our disease containment efforts are going to need to move toward mitigation. And what this means is that we will prioritize and focus our investigation efforts on confirmed individuals who have had exposures in congregate settings, such as healthcare facilities, correctional facilities, shelters, skilled nursing facilities, and so forth. And so as this situation evolves, as previously mentioned, we want to remind you that each of you plays such a vital role in helping us with our disease containment efforts. By staying home, practice social distancing, especially if you are ill. It makes a difference as cases will increase and resources will be much more impacted. Thank you.
Next we have Sheriff Bill Brown.
Thank you, Supervisor, and thank you all for joining us today for this briefing. I'd like to just bring you up to speed on some things that have been brought to our attention as concerns in the community, and to let you know what we in the law enforcement community are doing during these difficult times. The COVID-19 pandemic has presented law enforcement with a unique set of challenges as we continue to protect and serve the public. Normal patrol and jail functions have and will continue to operate as we progress through this difficult time. The Sheriff's Office, along with my fellow members of the Santa Barbara County Law Enforcement Chiefs Association and all law enforcement officers in our county, are committed to maintaining peace and order as we support our local, state, and federal public health authorities in their efforts to contain the spread of COVID-19. The Health and Safety Code authorizes health officers to take necessary steps to prevent the spread of infectious disease, and it grants to the sheriff of a county and his deputies the authority to enforce within the county all orders of the public health officer. That same authority is granted to chiefs of police and the district attorney and to all their sworn law enforcement employees as well. The order of the state public health officer, issued March 19, 2020, requires all people living in California to stay home or at their place of residence until further notice. While there are limited exceptions that allow movement outside the home, the intent of this law is to disrupt and to delay the spread of the coronavirus. Accordingly, we urge all members of the public to remember that the overarching goal is to protect them, protect their loved ones and their friends and neighbors by limiting contact with other people. We therefore continue to urge everyone to stay at home unless it is absolutely necessary that you leave. The levels of cooperation that we are seeing with the order are exceedingly high. The very vast majority of people are adhering to the state and to local orders. We've received a very small number of reports of violations, and some of those may have been misunderstandings about what is and what is not permitted under the health order. We will continue to handle any suspected violations on a case-by-case basis, starting with an explanation and, in all probability, a warning. If a person or a group of people continues to willingly break the health order, they could be charged with a misdemeanor crime. They could be cited, and in certain repeated or egregious cases, they could be arrested and jailed for noncompliance, particularly if a violator has been made aware of the order and still refuses to comply with it. In short, we in Santa Barbara County law enforcement, and that's the entire Santa Barbara County law enforcement community, want to be long on discretion and short on enforcement. We understand that these are trying times, and we have great concern and great empathy for the many people who are experiencing frustration, financial loss, heightened anxiety, and fear during these uncertain and troubling times. Make no mistake, however, in understanding that we will be steadfast and diligent in seeking out and bringing to justice criminal offenders who attempt to take advantage of this situation. Examples could include people who are conning other people by selling fake cures for the virus, people who engage in price gouging activities, or people who burgle closed businesses, for example. We will resolutely enforce the law and protect the owners of those businesses and the victims of those crimes. I am pleased to report, however, that the vast majority of our county's residents are complying with the order. Our activity in law enforcement, our arrests, and our jail bookings have declined considerably since the order was issued. To give you an example, this past weekend in the sheriff's jurisdiction, law enforcement calls were down by 28%. We received 277 calls versus 382 just 1 month ago in a similar weekend. Emergency medical services calls are actually down by about 10%, and jail bookings are down by 67% because we are encouraging law enforcement officers to not arrest and bring people into the jail if there are alternatives. On an average weekend, we see about 130 arrests that result in booking into the county jail. This last weekend, we saw 42 people booked into the jail. There has been an uptick in domestic disturbances. Not unsurprisingly, people are at home together and sometimes they're not always getting along. But by and large, we're seeing great success with the way our community is responding to this most important order. And we're seeing most businesses complying with the closure of those that are legitimately essential and remaining open. They and their customers are operating and behaving in a calm and cooperative manner for the most part. Banks have put colored tape on the floors to mark off 6-foot social distancing boundaries. Restaurants have closed their dining areas and reconfigured their counters to deliver food for takeout. Grocery stores are offering shopping hours for our heightened risk population and our senior citizens, and they're limiting the number of shoppers that are allowed in at one time. And restaurants are packaging ingredients and offering them as bulk sale items for people as well. We applaud such ingenuity to achieve compliance, and we're proud that once again, the people of Santa Barbara County are rallying together to deal with and get through yet another disaster. I'd also like to reference what we're doing to keep our jail as safe as possible. We have taken meaningful and significant steps to reduce our jail population and to keep the virus out of our jail. Effective since the order came out, and in fact effective a week or so before that, no unnecessary personnel are being allowed in the jail. Staff dining in the jail has been closed to anyone who doesn't actually work in the jail. Covid-19 education has been and is being provided not only to staff members but to inmates as well. We have stepped up cleaning and disinfecting of common areas and surfaces as well as housing areas in the jail. We've increased the distribution of personal hygiene materials to inmates and encouraged them to frequently wash their hands. We have also distributed cleaning materials to inmates that allow them to continue to disinfect and maintain their own housing areas. In-person visitation has unfortunately been canceled, but we have worked to try to increase the number of phone calls that can come into the jail for inmates. We are also increasingly discharging inmates early or triaging inmates and looking to see that the least serious offenders, if possible, can be released. And I'm pleased to say that this week we released 26 inmates early. And we're looking at a number of other inmates right now and trying to look for alternatives to keeping them in jail. Our inmate population is currently down to 766 inmates. That's the lowest number that it has been in the 13 and a half years that I have been sheriff here in Santa Barbara County. So I'm very pleased of the results that we're seeing as a result of our law enforcement personnel being encouraged to seek alternatives to arrest and our criminal justice system members working together to see if we can move some people out of the jail that don't need to be there. Beginning today, at our entry point to the jail, everyone coming into the jail, staff members as well as vendors and attorneys and everyone else that visits the jail, is going to be required to have their temperature checked. And if they have a temperature that is above 100.4 degrees, they will be denied entry into the jail. So, in closing, I'd just like to say that we are in the midst of an unprecedented public health emergency that is increasing in its scope and that everyone seems to think is going to peak here in the near future. It's going to strain our limited public health and safety resources, including law enforcement officers, but we will get through this. We are all in this together. We will work together with those who we protect and serve to achieve the very best possible outcomes, and we will succeed in defeating this virus. Thank you.
Thank you, Sheriff Brown. We'll now go to questions in the room. Tracy?
I'm Tracy Ware with KDYT in case you're wanting to
Come up a little closer to the microphone.
Sheriff Brown, can you talk about the amount of days maybe left on those inmates that are being released and what percentage that is of inmates?
Yes, Tracy. We had been engaged in an early release program prior to the COVID-19 outbreak, and we had been releasing inmates 21 days early on their sentences. There's a requirement that they serve at least 1/3 of their sentence. So if someone had a sentence that was less than the 21 days, they'd have to do at least 1/3 in jail before they would be released. During this time of emergency, we have increased that to 30 days, but only for those inmates who do not score very high on a ROVAR test, which is our instrument that determines what their propensity or their likelihood to reoffend is. If they have a high ROVAR score, we will still retain them for the full 30 days, or for the additional 9 days that we would have otherwise let them out early. And as far as the total number, we have probably released about somewhere between 3 and 4% of our population, which is comparable, for example, to what Los Angeles County has released.
I have a John Palmentary question asking, what if there is an emergency, Sheriff, like a cave fire, and people are sheltering at home? What's your advice for them?
Well, God forbid that we do have another major calamity like that happens while we're engaged in this, but if we do, we'll deal with it and we will impact it. Obviously, if a fire was proceeding to a neighborhood or to an area and was endangering a neighborhood, then all bets would be off on staying in your home, and we would order an evacuation, at least at minimum issue an evacuation warning, and that would be an extenuating circumstance that obviously would supersede the stay-at-home order.
And I have one more for Dr. Ann Sorg. I know during H1N1 children were not allowed in to see people in the hospital. If someone is in the hospital, say we have the one person you said with COVID-19, can the family even visit, or what is, what does the family expect to do?
At the moment, there are no visitors allowed to the hospitals.
Are there any other questions in the room? If not, we will go to the calls.
Malia, going to you. Malia Martin, go ahead. We'll mute you for now. I'm going to Tyler Hayden. Be prepared. We're going to unmute you. Tyler, go ahead.
Hi. Could you please speak to the preparations you're making for what sounds like a potential surge in patients, specifically how many more hospital beds you might need, if there are any plans to create sort of an ancillary hospital bed area in any facilities or outdoors. If you could just talk to any sort of planning that you're doing at the moment for what could be an influx of patients.
Yes, excuse me. Yes, our public health emergency preparedness manager is working with our healthcare facilities, and yes, there are active plans right now to surge at all our hospitals, and so that includes a number of ideas, and that also may include setting up tents, using hotels, and there's different ideas being discussed right now, but there are definite plans being discussed at this time.
Thank you, Malia. Martin, go ahead.
If incarcerated people in the jails are infected with the virus, will they be released under any circumstance that they're infected? What is the plan for releasing incarcerated people if they're infected?
Yeah, currently we have no inmates that we suspect are infected with the COVID-19 virus, but if we were to have a suspected inmate, that inmate would be quarantined within the facility, most likely in a negative pressure airflow area of the jail, until it could be determined whether or not they had the virus, and they would receive treatment. As far as discharging that inmate, if it became appropriate to discharge that inmate to a hospital, they would be taken to a hospital. If it became necessary for them to go to a hospital and they were either nearing the end of their sentence or they were in for a sentence where someone could receive an early release, then they would probably be discharged. If they were in for a serious offense, let's say they were in for murder, attempted murder, or something like that, they'd still be taken to the hospital, but they would be guarded at the hospital when they went there.
Thank you.
Are there any other questions on the line? We have a request for an interview. We will handle that separately later. I see no other questions. Malia, do you have another question?
No, sorry.
Thank you. Tyler, just checking. Santa Barbara Independent, do you have another question?
Nope, I'm set. Thank you.
Thank you, everyone on the phone. I see no other questions. We do have one more question in the room.
Tracy?
Dr. Ansor, there was, San Luis Obispo talked about getting 45-minute type test from Cepheid. It's a California company. Is that going to happen here? Can you give us a status on that?
Yes,
The question is, I don't know that that came through on the microphone, so let me just repeat
So-
that.
Oh, because the mic isn't there.
Actually, you know what, why don't we just put the microphone where it needs to be, and then we'll just take time for you to get your question asked. Thank you, Tracy.
So Dr. Borenstein from San Luis Obispo mentioned, I think it's Cepheid, I might be pronouncing it wrong, it's a California company that can do testing within 45 minutes. And you mentioned that we are going to get speeded up yesterday. Is that something Santa Barbara County will have access to?
Yes, we are actively pursuing to contract with this company, and we are getting the testing as soon as available. And it will be a significant improvement in our care here.
And lastly, I did outside ask Supervisor Hart how this is impacting him personally. He mentioned his mother's birthday was last week and he couldn't celebrate. Would any of you share how it's impacting you personally with, you know, your family isolation, beginning with the sheriff?
Well, obviously, I'm in a profession that's considered essential, so I'm still coming into work. But the rest of my family is, being required, obviously, to engage in the stay-at-home order. And I can tell you that my wife's going a little stir crazy, and they're going to be happy when this is over. But I think we fully understand what the ramifications of this are, and as we approach the next few weeks, it's especially important for everybody to stay the course and stay at home and really help us to flatten this curve out. What we don't want to see is our healthcare system get inundated, and just by taking the small step of sacrificing for the next few weeks until this order is lifted, of staying at home and not getting out there and putting yourself in a position to be able to have the virus transferred to you from another person is just an important step that we all need to do. And it's our time, our generation's time, that we have to do this for the collective good. And we understand that it's frustrating, and we understand that it's something that no one likes, but on the same token, it really is essential, and so it's really important. And again, I would just implore people to please stay at home. Don't make unnecessary trips out. I told my wife, I said, if try to treat this as though we live out in the boondocks somewhere, and you have to go in for one shopping a week and not shopping every day at the store. If we have to take steps to really limit the number of times that you go outside. So it's not an enjoyable proposition, but it's one that I think everybody can pull together and engage in.
We have more questions from media online. Nick Masuda from Santa Barbara News Press first. Rebecca Brand, be ready to be unmuted when Nick is through, followed by Tom Bolton of Newshawk. Go ahead, Nick.
Thank you. What is the breakdown of the 6 new cases? Where in the county, and what are the age brackets?
This is Paige. Let me see. It looks like most of the last 6, 4 are in South County and 2 are in North, and they're ranging between from 22 to 59 years of age.
Thank you.
Rebecca, go ahead.
Thank you. Dr. Ansorg, you mentioned in previous conferences that there are 62 beds and with ventilators available in our hospital system. I'm wondering, with our population size, do you have any extra, guesses or estimates of how many extra beds and ventilators you would like to have available for our size of population based on the trajectories of this illness in other municipalities?
Well, our emergency team has a cache of extra ventilators that are made available for hospitals in case they do run out. The good news about a ventilator is that mostly patients do not require to be on one for a prolonged period of time. So that's also why we urge everybody to stay at home so that not everybody gets sick at the same time and less people get sick. So obviously we would like to have even more capabilities, but we're doing everything in our power to procure as many as we can, and we have very robust plans in place.
Rebecca, do you have any further questions? If not, Tom Bolton sorry, Rebecca, go ahead.
Well, I just wondered if there was an estimate of, in even a medium case scenario of how many extra, if 62 is very light with beds for a population size, considering what's happening across the nation, or if 62 beds is, like nothing. I'm just curious about where that fits their population, and maybe there's more people in our community that could assist or volunteer or help to get what our community needs as far as medical help.
Well, I wish I had a crystal ball, but we really can't anticipate the exact numbers, and also not over what period of time they occur. So we are working tirelessly in planning ahead, and we are really feeling comfortable that we can meet the demand.
Thank you, Rebecca. Tom Bolton of NewsHawk.
Hi, thank you. The health director, either earlier today or I think earlier today, indicated that there were 2 communities that had at least 5 cases, and that may have changed given the new numbers. I'm wondering if you can tell us which communities where you're seeing the most number of cases.
This is Paige. We are looking at presenting that data in our future data updates, but we are not prepared to discuss that today.
Tom, do you have additional questions?
No, okay, no, I don't.
Thank you very much. So next up on the phone, we also have San Ynez Valley Star. Go ahead.
Hi, this is Riza Georgie, publisher for the San Ynez Valley Star. This might be just echoing off of what Tom just asked, but I've had a few readers reach out to me and ask if any of the confirmed cases were from the San Ynez Valley.
Again, we have very specific requirements regarding what we can release, and depending on population size and so forth. And so that information, I expect, will be forthcoming in the future.
And I'm just going to ask one more, Paige. It might as well be you. I'm hearing how people are protecting, at least healthcare workers are protecting themselves when they get home. Do you have a routine to protect the people in your household when you get home?
Well, after working 14, 16-hour days, yes, I do. I'm very methodical about hand washing and making sure not to touch my face. And my entire family, we're really conscientious about hand washing and that sort of stuff, and social distancing.
And clothing, though? Is there anything you do with your clothing from what you wear?
Take off my lab coat in the car.
I think that's it for questions. Thank you for joining us today. We will host another press conference tomorrow at 4:30 p.m. If you'd like more additional information on the local response to COVID-19, please visit publichealthsbc.org or call 833-688-5551. And a recording of this press conference can be viewed on Channel 20 on the county's website or on the county's YouTube page. Thank you all for participating today.